Hello, and welcome to the Social Security Show. I'm Daniel Summer, Public Affairs Specialist in the Chicagoland and Northwest Indiana area. To my left is another person who needs no introduction, but I will go ahead and allow her to introduce herself.
Thank you so much, Mr. Summer. My name is Josephine Mueller, and I am also a public affairs specialist here with the Social Security Administration. And we are so excited to be here with you today, Chicago, to provide information about Social Security.
That's great. But you know what? Today is a direct result. This show comes from a letter that I received, Josephine. It was one of those Dear Mr. Social Security letters, and people had a question. And the question is, what's going on with Medicare? Explain to me a bit about Medicare. I'm lost. And they asked, why can't I just go into the Medicare office and get information? And what has Social Security got to do with it? Josephine, would you care to answer that about the Medicare office?
Yes, that is a great question. And here at Social Security, we help individuals apply for Medicare Part A and Part B. However, we are the Social Security Administration, and there is another agency that is called Medicare, which they do provide services via phone and via online.
So, in other words, you can't go into the Medicare office because there's no such thing. Social Security, however, works with many of the same individuals who need Medicare. So to make it easy and convenient for the public, Social Security will take an initial application, help you with some Medicare issues, and move forward like getting you a replacement card. Just another way that we try to serve the public, Josephine. So can you tell me just a little bit more about Medicare in that? What is it? What is Medicare?
Yeah, let's talk about what is Medicare, because many times people who are approaching age 65 start to receive several phone calls and letters in the mail from different agencies that are soliciting their business. And sometimes individuals think, is this Medicare that's contacting me? Who are these companies that are contacting me? Well, we're here to tell you today that those are other insurance companies that are soliciting your business. However, when you do come to where you're approaching age 65, in order to obtain Medicare, you are going to want to contact Social Security so that way you could apply for both Part A and Part B, or just Part A if you choose. Now, let's break down what Part A and Part B is. Medicare Part A covers emergency hospital visits, and Medicare Part B covers 80% of regular doctor's visits.
When we're talking about Medicare Part A, essentially, if you're an inpatient in the hospital or need to be in a skilled nursing facility, that is the point at which you're going to be utilizing this very important benefit. Now, Medicare Part B is quite different. There's a big difference between being in the hospital, being hospitalized, Josephine, and using Part B benefits. Those Part B benefits are what people use for outpatient care. You go to your doctor, he tells you to stick out your tongue, he's going to check your blood pressure. All of those things are outpatient care, and we definitely want you to be able to get good health care. So Part A is hospitalization, Part B is outpatient care. Those are the parts of Medicare referred to as original Medicare because they really and truly originate with the government. So those phone calls that Josephine was talking about come from companies, for example, that want your business for Part C Advantage plans or Part D prescription plans. All of those things matter a lot. And the fact remains is we want you to be very careful when choosing Part C Advantage plans because there's some caveats to go along with that. Aren't there, Josie?
There is. And we just want to make sure that everyone is informed that here at Social Security, we help you enroll in Medicare Part A and Medicare Part B only. And so many of you may be wondering, okay, well, now I know what Part A is, and now I know what Part B is. Part A is emergency hospital visit coverage, and Part B covers 80% of regular doctor's visits. But how do I qualify for Part A? Is there a cost associated with Part A? And is there a cost associated with Medicare Part B? Because many of us are thinking, well, what about the cost of it. How much is it to receive this benefit? Well, we can tell you here today that Medicare Part A is free for most individuals who have paid into Medicare taxes. In Part B, there is always a premium associated with Medicare Part B. So the premium for this year in 2023, the standard Medicare Part B premium is $164.90 per month.
You know, that's very interesting, Josephine, because I had someone ask me about something related to a premium. They said, I got this letter that says my premium is going up, and it's because I have too much money. That's not fair. And I had to explain to them that the premium that people pay for Medicare Part B is very, very subsidized. In other words, the government pays all of that amount except for the premium amount that you just stated. So therefore, here's how that breaks down. When an individual has higher income, they get less assistance or subsidy from the government. The higher your income, the less subsidy you get. So you're paying about 25% until you reach the next tier. Then you're paying about 50%. Then you're paying 75% if you make more. And finally, you end up paying the whole amount if you have lots and lots of income. So it's not as if they're raising the premium. It's just that the government is paying less of the amount of that premium on your behalf.
That's great.
Income-related adjustment amount.
Yes, and we have heard of many individuals impacted by Irma. And so that is for individuals, as you mentioned, Mr. Summer, this is great information for people to be aware of, for individuals that are high income earners. So individuals who do have higher incomes flowing in, they do pay a higher Medicare premium. And so that is for individuals in that situation. But a lot of times too, we receive, information, or individuals tell us, or they'll contact us and they'll say, you know what, Daniel, Josephine, that premium that's $164.90, the Medicare Part B premium, I simply don't have a budget for it and I need assistance. Is there a way for me to obtain assistance to pay for that Medicare Part B premium? Because I really need the Medicare Part B. However, I need assistance with that. And so when individuals are in that situation, what we let people know is that they may visit their Department of Human Services or public aid office and request to have an application taken so that way the person can obtain assistance in getting their Medicare Part B paid for. So if a person is approved through the Department of Human Services with this application, then what will happen is the Department of Human Services will get in touch with the Social Security Administration and let us know that they are going to be paying those premiums for the individual, as long as that individual qualifies. Now, keep in mind that is a program that is needs-based, so an individual would need to have limited income and resources to qualify. However, we do want to let everybody know there is assistance for individuals in that situation out there.
Thank you, Josephine. That's great information. I used to work for the state of Indiana, and therefore I processed a lot of those applications. And it's a big relief for individuals who don't have to pay that $164.90. It might sound like it's not $1 million, but the more you have, the better, especially when an individual is low income. So we encourage you to not only fill out that application, but look out for what we call extra help with Medicare Part D. Now, Part D is a bit different than the Part A and B that we discussed with you because it deals with prescription drug coverage, something we haven't talked about just yet, right, Josephine?
Yes.
Because if you go to that hospital using your Part A or go to that doctor using Part B, chances are they're going to prescribe something for you. And how do you pay for that? Well, private companies, not Social Security, because this is not part of original Medicare, which is, again, only A and B. They offer Part D prescription drug plans. Now, those prescription drug plans come with a cost. Sometimes that cost is covered by that assistance we discussed a moment ago. But if you get a prescription Part D drug plan because you need one, and you have Medicare Parts A and B, and you get assistance, That's just not a bad combination of Medicare coverage. Wouldn't you say that's good, Josephine?
Definitely. And there are programs out there to provide assistance. As you mentioned, Mr. Summer, we have that Part D subsidy application. If you visit us online at socialsecurity.gov, you will see that there is an application for a Medicare Part D subsidy. So if you do have a Medicare Part D prescription drug plan, you can definitely apply for extra help if you are in need of that extra help. Now, keep in mind the extra help is for individuals who have limited income and resources. And if you are approved for that extra help, your approval may be where a portion of your Part D prescription drug plan is paid for, or it may be that the entire amount that your prescription Part D, what it costs, is completely paid for. And the only way to find out if you would be approved or not is by applying. So if you are in that situation where you would like and are in need of that assistance for the prescription drug plan, please visit us at socialsecurity.gov and apply for the Part D subsidy.
And speaking of applications, Josephine, we need to talk about applying for Medicare because many people are so confused by the enrollment periods. They hear that if you don't enroll right on time at the perfect moment, that you're going to face penalties and something bad's going to happen to you. But I think that there are 3 different times at which we need to discuss people enroll. So if you wouldn't mind, I think I'd like for you to tell our readers, our viewers, the people who are listening to us, all about the initial enrollment period.
Yes, let's talk about the initial enrollment period because so far you have learned what Part A and Part B cover. You are aware of the Medicare Part B premium and you know that you can apply for extra help for that Part D prescription drug plan. But let's talk about the enrollment periods now. And that first enrollment period that we're going to talk about, as you mentioned, Mr. Summer, is that initial enrollment period. So when do I apply? I'm going to be turning 65. When should I get the ball rolling? When should I start? Well, our initial enrollment period is 3 months before we turn age 65, the month we turn age 65, and 3 months after we've turned age 65. So that is your window where you are in your initial enrollment period. Now, keep in mind, you can apply at any point during your initial enrollment period. However, the later you apply in that initial enrollment period, the later that your Medicare Part B is going to be effective. So if you want your Medicare to be effective right away when you turn age 65, you're going to want to apply in the 3 months before you turn age 65. So we have a lot of information on our website if you visit us at socialsecurity.gov regarding the enrollment periods, the initial enrollment period, and when your Part B will be effective when it is time that you enroll. So you're going to see that information on our website at socialsecurity.gov, but you will also see that information on Medicare's website at medicare.gov.
That's amazing. And just remember, it's called the initial enrollment period because it's that first period in time when you are eligible for Medicare on an ordinary situation in which you're not disabled and you haven't got an end-stage renal disease or anything of that kind. However, there's something else other than that. There's another time, because what if an individual doesn't want to enroll in Medicare when they're 65 because they're working and they've got coverage and they don't want to pay that monthly Part B premium we talked about? Well, there are special situations which exempt you from penalties. That's right, you will not have to pay penalties even if you wait longer than age 65 under certain circumstances. Here are those circumstances. It doesn't matter how long you wait. You could be 70, 80, 90, 100 if you have group health insurance coverage through your own employer or a spouse's employer and they're currently working for that individual. Let me say that again, not retirement coverage. Group health insurance coverage through a current employer means that you can delay enrolling in Medicare without a penalty. And when we talk about penalties, Josephine, people get worried. There's like, what's going to happen? Do I go to jail? But no. But let's just say you have someone who does not have group health insurance coverage, and they're not exempt, and they can't put that off indefinitely. Well, if I decide I'm just not going to do it and I'm 65, well, for every 12-month period for which I could have had group health insurance coverage, but I decided not to, my premium will increase 10%. So let's think about that. If I turn 66, 67, 68, 69, 70, I could be looking at 50% higher just then. And it can go on and on and on, because some individuals need to apply during that initial enrollment period. But like we said, there's a special enrollment period for individuals who have coverage, and that covers that. I think we've got just one more enrollment period, Josephine, that we'd like to talk about, and I'd like to know if you would like to cover the general enrollment period.
Absolutely. Let's talk about the general enrollment period. So the general enrollment period is open to individuals that are past the age 65 that do not qualify for an initial enrollment period and do not qualify for the special enrollment period. They're able to apply during a general enrollment period. And the general enrollment period is any time from January 1st through the end of March. A person can apply for the general enrollment period of any year. So if you are an individual in that situation that you are unable to apply during the initial enrollment period anymore because you're significantly past age 65, and say you don't qualify for this special enrollment period because you do not have active employment and health insurance through that active employment, or you're not covered under your spouse's group health plan and they have active employment, so you don't qualify for that special enrollment period, you still have the opportunity to qualify for a general enrollment period. And once again, that's anytime. You can apply anytime in any year between January 1st through March 31st. So you do have to apply anytime between those dates of the year. Keep in mind, though, if you do apply within that time frame during the general enrollment period, you will be subject to that 10% increase that will be for every year past age 65. There is that 10% penalty for not having enrolled during the initial enrollment period or a special enrollment period.
There's one more caveat in which you might want to be careful about the general enrollment period. Because even though you apply between January 1st and March 31st, unlike the initial enrollment period or a special enrollment period, your coverage will not begin right away.
You're right, Mr. Summer. It does take about a month. So previous to 2023, in 2022, it used to be if you enrolled during a general enrollment period, your Part B wouldn't become effective until July. But now we are in 2023 and a few things have changed. So if you apply say you were to apply this year in January, and I know January is already gone, but say you would have applied this year in January of 2023 during the general enrollment period, your Part B would then be effective in February of 2023. So it's going to be effective the month after you apply. But keep in mind, you only have that 3-month window at the beginning of the year for a general enrollment period.
That's interesting. You know, a question I've come across also is, does Medicare start automatically for everyone? And I think there's a real distinction we need to make between people who are getting their Social Security benefits and people who are not. You know, if you're getting your Social Security benefits, say at age 62, 63, 64, and along comes 65, guess what? We will make the presumption that you want your benefits just like you want your Social Security benefits. So Medicare benefits will be the same. They'll just automatically begin. You'll get a Medicare card in the mail. It'll be red, white, and blue from the Center for Medicare Services. That's great. But what about those individuals who don't want that because they still have that group health insurance coverage? They can cancel it. You can still opt out of that. You just let them know. However, there are individuals who haven't applied for their cash benefits. And what happens to them, Josephine? Do they have to do anything special?
You know what? That is a fantastic question, Mr. Summer, because as you mentioned, when somebody is receiving benefits at 62, 63, 64, and then if 65, when 65 comes around, it's automatic for that individual because they're already receiving those cash benefits from Social Security. But if somebody isn't receiving Social Security benefits and 65 comes around and that individual wants Medicare, what has to happen in that situation, the person has to request to apply for the Medicare. That's the only way we know at that point that you would like to have Medicare Part A and Medicare Part B.
Interesting. So now you know. You've got to make that application if you're not already getting your benefits. But if you have more questions, be sure to contact the Social Security Administration, or for other information about Medicare, such as why claims are being paid or not being paid, call 1-800-MEDICARE. And that in numbers is 1-800-633-4227. We'll see you next time on the Social Security Show. Josephine and I are glad that you watched, and now you know all there is to know about Medicare in its most basic form. Have a great day.